Evening and welcome back to Dr. Brandy's Pearls. I appreciate you all for joining me and hanging in there. Trying to keep my episodes as consistent as I possibly can. I was intending to do this bi-weekly, but it looks like it's going to be a once a month thing for me. But welcome back anyway, and thank you so much. This episode is about clinical confidence. And I think that it's so important that we do discuss this because, it doesn't matter where you are in your career as a nurse practitioner, whether you're a student, whether you're a new grad, or you've been in your career, but now you're doing something different, or you're just in a different scene. And I really want to talk about that. That's something that I have included into my NP survival workshop as talking about clinical confidence. And I'm so excited that I had thought about doing this because definitely this workshop is starting to become something that other places are looking to implement from me into their training for hiring, as well as possibly a course in other businesses, helping locums get new nurse practitioners positions and so forth. So I'm really excited about doing this. I think that I've gained a lot of experience and a lot of knowledge, and I've collected a lot of data in the process of being able to put together such a course and being able to talk about the things that I talk about with different nurse practitioners that I meet, as well as those that come to me and have questions about contracts, about clinical, about being a new nurse practitioner, or just about changing their career or learning how to do different things within their career because they've never done them before. I've had practitioners that have been practitioners for a very long time, but they need questions answered about how to go about doing different things that they've never actually done before, and I enjoy helping and talking to people, and I think that it's so important that we do exactly that for each other, but we must be genuine about the help that we provide and the information that we give. And I think that that's something that kind of gets lost in that, with people giving out information or just being a false prophet in the sense of where they're going, what they've done, where they've been, and things that they do. So I think that it's important that we are genuine in it, but I feel like we should always be willing to share at the same time. And although sometimes I feel a little like I need to keep certain things to myself because people tend to take it and roll with it and do their own thing with it, I still don't want to necessarily not do it because I think it's so important that I'm able to share my experience, my knowledge, and the things that I've worked hard to put together for others to help them grow just the same. Whether somebody gets to that success point that I'm trying to get to before me, but I was able to help them get there, I definitely will still give them an applaud and pat them on the back because I knew that I helped them get to that point, So let's talk about clinical confidence as a nurse practitioner. And again, it doesn't matter where you are in your career, whether you're just starting out, whether you're in the middle, whether you're trying to transition. But this is something that is probably the most important part of being a nurse practitioner. It's not just the education you received. It's just not knowing clinical guidelines. It's not just finding a job. It's not just feeling like you're ready or not ready. It's the sense and the mind of trying to get yourself to this level of, I got this, I can do this, I know my stuff, I get the clinical guidelines, I can intuitively talk to my patients and figure out where to move forward. I try to encourage nurse practitioners to remember, you've been doing this for a long time. Although there's all these arguments about who's been in school longer, who has this type of license, who has this type of education, the truth of the matter is we have this education. We've done more than one anatomy and physiology class. We've been talking about drugs that patients take since we began our nursing career. We've been seeing different types of diseases since we began our nursing career. It's just a matter of tweaking how we utilize the information now, and using it more so in the sense of, okay, well, now I am the provider. I get to treat this person. I don't have to ask anybody, how do I treat this person? I know how to treat this person. I know how to make this person better. I know how to coach this patient. I know how to educate this patient. You know, we have to start giving ourselves confidence. If we're not confident in clinical, our patients are not confident in us. And the other medical community around us, those that love us, even those that hate us, will not have the same confidence in us because we don't have it in us. You know, we have to stop sharing so much information on social media about patients. That's something that I definitely think is, doing a little much. We need to utilize these groups to help uplift each other and help each other figure out how to move, strategically in our careers in order to gain more and do more and be seen more as a great contributor to our profession and for our patients and to healthcare, and as leaders, because we are leaders. We are at the top of the food chain when it comes to healthcare. We stand side by side with all those that are considered to be the decision makers, the diagnosis or the diagnose. Oh, I can't talk today. The diagnose, the person that diagnoses patients or decides how, the healthcare team should roll in order for that patient to have the best care. So confidence. How do you get this confidence? It's not just about being in the clinical site and actually working with the patients to get that confidence. That confidence starts with you and where your mind is. Are you really ready for this? Are you built for this? Are you ready to transition into a nurse practitioner role? Are you ready to transfer and transpire into something higher? Are you ready to, transform into a different role as a nurse practitioner? Did you work in this area in the hospital at one point and now you're in a primary care setting and now you're really, the lead in the clinic? What are you ready to do? But you have to figure these things out. Your mind has to get you there. Whether it's that you're writing out affirmations every day to help yourself get there, talking to yourself in the mirror, telling yourself you're ready to do this new thing. You're ready for this. You have the confidence to get through this. You're strong. This is what you want. This path is the path that I need in order to get where I'm trying to go. I have this. I got this. I can do this. I know about this. Whatever it might be, whether it be that you're sitting down writing goals that you want to accomplish. You have to get to that mindset. If you don't have clinical confidence, nobody else has clinical confidence in you. That means the people that work with you, that work for you, and those patients as well. And anybody else that has contact with you will not see it, and they will not trust you any more than you trust yourself. We have to learn how to have confidence in our knowledge and stop second guessing ourselves. Yes, you should think very strategically about how you're going to handle certain healthcare problems and issues that arise, not just with your patient, but even within an office as a whole, or dealing with insurance company or so forth. Yes, you have to think about these things, but the truth of the matter is, what to do. We're so busy talking to ourselves and negatively talking to ourselves that we constantly rethink everything over and over and over again, as if we don't know this is where we're supposed to be, what we're supposed to be doing, and this is the path that we're supposed to be on. And many of us will probably quit tomorrow. And clinical confidence also starts with what are we doing for ourselves so that we have the best experience? Are you picking the right clinical sites to get the best experience? Are you networking with the right people in order to get the best experience or even the best advice? Everybody is not meant to be around you. Everybody's not meant to give you advice. Everybody's not meant to help you go into the path that you're going into. You have to be careful with the people that you let speak on your career or help you to do certain things in your career. Everybody does not have good intentions. Everybody's focus is a lot of times on themselves. It's not even about you, but they see an opportunity where they can get something from you in order for themselves to gain. We do need structure and guidance in our careers and even in our lives, whether it's personal or professional, to help us get on the path that we want to get on, to keep us positive and keep us focused. But how can you do that if you're constantly negatively thinking about things and you're constantly putting yourselves in different situations where you have people that are going to pull you in the wrong direction and have you second guessing yourselves? You can't do it. You cannot do it. In order for you to truly be able to survive as a nurse practitioner, or even to get started as a nurse practitioner, to get your first job, to land that first contract, to get that 6+ figure salary with benefits that are not going to change your salary to a 2-figure, to a 5-figure salary. You have to remember that. But that's a whole nother conversation. In order to do that, you have to have confidence. You have to have confidence in yourself. You have to have confidence in what your abilities are. You have to have confidence in what you can bring to the table, how you can transition a situation, a office, a clinical setting. What do you have that it makes you special? But you only know that. You know what makes you that way. And you have to elaborate with that on a CV, in an interview. And even when you walk into a room or into work, you have to show that. You have to live that. You have to breathe that. You have to speak it. If you can't do those things, this is not for you right now. You need to work on your self-confidence, your clinical confidence, your positivity, your self-love, your thought process. These are things that we talk to our patients about all day long, but we don't do it for ourselves. You have to do it for yourself. The only way for you to be successful clinically is to have that confidence. And it isn't just about knowing what was in a book that you read. You have to take that information and speak it confidently. It's okay for someone to help you understand things better, maybe even correct you if you need it. But if you can't speak with confidence, or you don't understand what you're supposed to be doing, or you don't feel confident in talking to a patient, or let alone another provider, about what your plan is going to be, or how you're going to help somebody, or even just discussing general research or general conversation about chronic illness or holistic care or whatever it might be, you will not be viewed that way, and you will not feel that way. So I'm telling you now, one of the key things for you to be successful as a nurse practitioner, period, no matter where you are, is that clinical confidence. And that is going to start with you mentally getting yourself to that point, mentally talking to yourself, mentally pushing yourself into that direction. And if you don't have it, you can't grow. You can't move forward. And I know that in my group on Facebook, I try to post things all the time that push people toward that, along with advice about becoming a nurse practitioner and about doing things that you need to do to grow yourself as a business, or even as a student, or as a new student, or finding a job, or whatever it might be. But I hear so much negativity come out of so many nurse practitioners' mouths, no matter where they are, about not feeling confident enough to do certain things. This is why they have not been able to grow themselves or get where they need to be. So right now is that time. You have to start using your mind to get you where you need to be. And that means being able to talk yourself into a positive, confident thought process where you can walk in that way. You need to walk that way. You need to dress that way. You need to look that way. You need to interview that way. You need to write that way. Confidence, confidence, confidence is key. All right. Well, I hope that was helpful to you all. If you have more questions, you have more thoughts, please feel free to reach out, send a message. You can also reach me on Facebook at NP Real World Survival, or you can even send an email if you'd like at Dr. Brandy, Brandy, fnpc@gmail.com if you have any questions, concerns, or even thoughts that you want to have me add as a show. But I will be back very soon with a whole new topic. Thank you for joining Dr. Brandy's Pearls.